Hi everyone, welcome to Kriti's tutorials. In previous session, we were discussing about some general information about the diabetes disease. We have seen the type of diabetes, we have seen the complications, and we have discussed about the symptoms and all those things we were discussing in the previous sessions. So, today let me discuss about one important factor which is the harmful effect which is being formed in our body if we have high diabetes. That condition, it is called as diabetic nephropathy. So we all know that kidneys are the very small organ which is present in our body in the abdominal region. So what is the function of kidney? Kidney generally filters the blood and it removes all the waste from our body and keep our blood healthy. It helps to maintain the balance in our body. Our osmotic balance has been well defined by these kidneys. So this kidney, it is said to be the microfiltration unit which is eliminating, which is not even keeping a single percentage of waste in our body. It eliminates all the waste produced by our body along with excessive water. And now, how is the diabetes related to kidneys? Is there any harmful effect? Yes. So, the type 1 diabetes and type 2 diabetes are directly related, or these both type of diabetes are directly related to the effect of kidneys. So, kidney related problems exist in the condition of diabetes. So, let us discuss about this thing in detail in this class. See, how does the kidney filters or purifies our blood? When the blood enters into the kidneys, the kidney removes the waste materials present in our blood and they eliminate it in the form of urine. Now, what happens if the waste is not released by the kidneys? When the sugar content is very high in the blood, obviously the density of the blood becomes higher, which ultimately results in the toughness of the process of filtration. There exerts some pressure. With this high pressure, the blood vessels which are carrying the blood also gets a lot of pressure, which leads to the again hypertension condition. So having diabetes is not a single complication. It is the connection of many other complications like hypertension and like high cholesterol. All these complications are generally interrelated to each other. See, because of this presence of sugar, obviously the pressure in your blood vessels gets increased, and we can say that it results in the blood pressure also. So, when these dense metabolic waste and the high sugar is dumped into your blood, it leads to the hypertension. And if there is some high fat content which are accumulated or deposited, it again leads to the high cholesterol. These conditions, the diabetic related conditions which affects the kidneys, it is called as diabetic nephropathy. So slowly this infection, it does not the onset of this infection is not happen all of the sudden. This happens slowly and gradually. So slow onset of symptoms happens in an individual, which ultimately depicts the quality of the functioning of your kidney, and ultimately it results in the condition called as ESRD. What is ESRD? ESRD is nothing but the end stage of renal disease. What is renal? Renal is nothing but the functioning of the kidneys. If the kidneys fails to work, that condition we call it as ESRD, end stage of renal disease. So if these condition exists, so let us we have to always note how our body works. If you are being diagnosed with the diabetic disease, there are some certain things which you have to follow in your body, so that you can have an idea that how far is the diabetic affecting your body. So first, let us discuss some symptoms that your kidneys are slowly getting damaged because of the onset of the diabetes. First one is uncontrolled blood pressure. As I have told you earlier, excessive pressure in the blood vessels, which results in the toughness in pumping of the blood, which results in hypertension. Next one, the protein in urine. Okay, if the protein content is seen in the urine, we can identify that there is some damage which has been started in your kidney. Then, if you observe any swelling on your feet, on your ankles, or in your hands, if the edema condition occurs, so we can also doubt that there is some infection or there is some malfunctioning of your kidneys. And then the next one, it is what is that? We have to be very careful to monitor the insulin levels in your body. So you have to go for regular sugar test, which clearly tells you how much amount. In previous sessions we were discussing about the range of diabetes. So this will still give you clear idea that how far is your sugar in your body and how it is slowly affecting the other organs in your body. Then you feel a little bit confused mindset. You will get lot of stress, lot of confusion mindset, and you will not be able to concentrate on things. So this is also one of the symptom of some kidney damages. Then shortness of breath, loss of appetite. What is appetite? Appetite is nothing but the hunger. Okay, so if you are having loss of appetite, shortness of breath, nausea, vomiting, then if you have itching in your genital areas, it is very, very important symptom that your kidneys are slowly started to get damaged. So persistent itching, if you find persistent itching after urination, or if you have taken any sort of food, it mainly causes it may be infection, but we should be very careful that it is just an urinary tract infection, or the itching is being caused because of the renal damage. Then fatigue. Okay, so these are some of the symptoms which is going to make you aware that you are having some kidney related problems. So how far if you find any fluid retention in your body, so if you have any swelling on your feet or in your ankle or in your hands, so you have to first consult the general physician how far is your body health conditions. Then if you in general test, if you find the potassium levels is high, you can easily diagnose that you are having some kidney related problems. Then anemia. If you feel anemic, is nothing but the less amount of blood. If the quantity of the blood is it is also one of the factors. Okay, then apart from these diabetes, see, kidney damage. If when we are talking about this kidney damage, let me discuss with you a few points which are some of the other factors which is depleting the function of the kidneys. First one is over usage of painkillers. Painkillers, why painkillers? You just try to do some physical exercises, or some of the what is that, some of the physical exercises. It is the correct treatment for you to relieve yourself from the pain. You can go for meditation. First, release all your mental stress. So the stress busters, stress relievers are very, very important, which is going to drastically decrease your pain by improving your mental health. Next one, no adequate amount of water. Take water frequently, at least 3 to 4 liters of water per day, because having plenty of water makes the functioning of kidney more easier. And if you are not sleeping properly, if you don't have healthy sleep, it is also going to be one of the main factor for your kidney damage. Then those who are meat lovers, try to minimize the quantity and try to minimize the number of days of consumption of your meat. So it is going to give you a good health to your body kidneys. And consumption of alcohols and smoking is also going to be one of the serious thing which we want to control to maintain a healthy kidney. So if we are talking about these kidneys, kidneys are said to be the most amazing organs in your body, which is eliminating all the metabolic waste in your body. So these kidneys, do you know why kidneys are said to be the most amazing organ? Even if one kidney fails, the other kidney can take up the function of both the kidneys. See, we people are not supporting those organs. The body, it functions in such a way that it can rectify its problem by itself. But the thing is, we have to give some opportunity to our body to do their own work. When the kidney is trying to make up, if one kidney is damaged and other kidney is ready to take up the work of both the kidneys, why don't we support that particular organ by avoiding certain food habits and having the frequent sleep, taking adequate amount of water. So these factors are very, very important, which we are not following nowadays. So my dear people, I want to tell you one thing. Always, as I told you in the previous session, prevention is always better than cure. Don't wait for any disease come inside your body. Try to maintain healthy habits. Try to do meditations, try to do yogas, and try to always keep your mind stable and healthy. That is going to be the most important factor which is going to ruin out you from many diseases. It is not going to harm you in any way. So as a part of discussing this, we should be, as a part of showing some gratitude towards our body, we should be very careful, and we should be aware that always prevention is better than cure, and try to keep your body healthy as well as your mind. Healthy mind gives you the healthy body. Thank you once again. Tomorrow let me meet you with one more disease related to diabetes. If you have not subscribed my channel, kindly subscribe so that the good things and awareness may pass to many people. Thank you.